The Todd Shapiro Show. Canada Laughs. SiriusXM 168.
The dog loves the doc, Dr. Schecter, and the cat loves James Mullinger. And you know, now this back thing happened, and I guess from what I hear, can CBDs help me with this as well?
Great question. So both THC and CBD can be super effective in managing your chronic pain. CBDs help with inflammation, so it'll take the edge off throughout the day, not cause any type of impairment. Whereas THC, not only will it make you think a bit less about your pain, which is great, but it can also increase the pain effect or the anti-pain effects of CBDs, let you do a little bit more physiotherapy, get over the physiotherapy a little bit more, and overall make the pain easier to deal with and also easier to sleep.
Well, and I'll tell you, the sleeping has definitely been affected. So I asked you, and I have done a few CBD pills that I have. I think they're called Tweed Lot 3. How long, and I don't know, James, jump in at any point here, because, you know, I think they're in Europe, they're not quite as advanced in terms of their mentality of legalizing marijuana and using it for medical purposes.
But in New Brunswick, of course, they are, and there's lots of big companies growing out of their organogram and companies there. I mean, I guess the thing that's always fascinating to me, just asking as a novice to it, is like, is how does one find that dose whereby they can alleviate the pain or indeed alleviate the anxiety without having essentially stoned effects?
Yeah.
How does one get that? Especially because everyone's got different tolerances. I have friends that can, you know, that have enjoyed consuming for many, many years and can function anything on it. Whereas me, on the other hand, if I have one...
And you probably don't want to see them not on it, because they're probably a basket case.
Exactly. Whereas for me, if I have one toke on something, it's like I've taken like 10 pounds of ketamine. I can't walk, or, you know, so how does one get that balance right? And
I'd like to see you on 10 pounds of ketamine.
Hey, well, that can happen on this show.
But basically, that's also a great question. Basically, how do you find your right dose? And it's basically the same as American barbecue, which is start low, go slow.
Right.
And what you do is you start off, if you're inhaling, take 1 or 2 inhalations, wait an hour or 2, see what happens, and then just keep going up until you hit that sweet spot where you get some pain relief, you get a little bit of the edge taken off, and you're not impaired. And it's really important to keep track of what you're doing, either with a notepad or an app or something along those lines, so that you can really go back and reflect on what is it that helped me, so you remember the next time.
Dr. Schecter, how long have you been an advocate of marijuana for all different sort of reasons for patients, really, for medical purposes?
Well, I'm incredibly fortunate to have started the first referral-only clinic in Canada dealing with cannabinoid medicine. So I've been doing this intensively for the past 5 years. I've seen about 5,000 patients and helped them in their journey in accessing and using and discovering medical cannabis. My patients range in age from 1 year old to 101. Yeah, we have pediatric kids who have treatment-resistant epilepsy. And they've tried sometimes a dozen different medications. They've had surgical interventions, and nothing works for them, so the parents try them on CBD oil. And that's why we help them. And it's those patients, as well as patients who are older, who don't want to go on opioids or who want to get off of opioids, that I see incredibly improving on their day-to-day life. They can actually go back to work. They can have the life that they want to live.
Yeah, and I hear this a lot from people who are you know, I mean, people in my community and friends. Like it's quite a remarkable phenomenon, especially for something that's taken this long for legalization to happen. And yet, I would say of everyone, it's like half of the people I know are currently being helped in one way or another by cannabis as a medicine.
There truly is nothing but positive stories once the stigma is away from it. Once people sort of think past what they've always been told or taught. Rarely have you heard someone say, my goodness, like, you know, you think of a drunken night, right? There's a lot of bad stories that have come with drunken nights. Rarely, very rarely, and I don't even think ever has there been a story, at least in my circle, where someone had a really terrible experience from just simple cannabis.
Yeah, my worst cannabis story was spending a night in jail for it.
Yeah,
right?
That's it,
right?
That was not terrible. Yeah. And there were a lot of perks to that. I mean, listen, James is a very good-looking guy.
I true. I mean, one of my patients tells me, you know, doc, the worst thing that happens is I giggle like a girl, I raid the fridge, and I go to bed.
Terrible
And, you know, that's pretty much the only way you can really overdose on cannabis.
Doc, now, Dr. Schecter, how can people get a hold of you? Like, if they have some questions or they're curious, is it through Tweed Main Street, or is there some sort of practice as well that we can?
So my friends at Tweed Main Street have all of my contact information. I've been working with them very closely for the past 4 years. They've been supporting me in providing medical education and talks to other healthcare professionals, pharmacists, and the public. And I also have a clinic called the Cannabinoid Medical Clinic.
I love it. You just know you're not embarrassed. Just put it right out there on a sign, right? It's what you do. You're proud of it, and this is the way the world is going.
I took a lot of flack when I opened up the clinic.
I can only imagine. I was going to ask you about that. Like from the community of doctors, which by the way, some are very snobby. Did they look down on you, Doc?
They were saying, "Why are you doing this? You're throwing your license away. Your career is going to go down the tubes."
And yet you're going to go down in history as a pioneer.
Yeah,
exactly.
man. Isn't that wonderful?
And now I say to them, look who's on the wrong side of history.
You seem like a cool doctor.
Yeah, you do. I want you to be my doctor. Yeah. You're a cool doctor.
Do you check prostates? I don't know.
For an extra charge, I'll do anything.
So, I mean, in terms of the back pain, I actually haven't gone and seen a doctor yet. I have been through it before in the past. And usually it's been a lot of rest, but I'll tell you that I'm so against painkillers, and you mentioned opioids and stuff earlier, and that's the last thing I would ever do. I don't even like Advil or Tylenol. That's how I am, and I found out that even Tylenol is like plant-based. I didn't even realize that, but it's good to know. And you know, I am a medical patient, and that worked out well. I originally got it for the anxiety, as I said, and I will explore it. And with that being said, I guess I should still make sure. I should still get checked out to make sure everything's okay, right?
That's right. There's a few things we want to know to make sure that it's nothing dangerous with regards to back pain. Make sure that you don't have any tingling numbness down your legs, you don't lose any sensation in your genital region, or you don't have any weakness in your legs, as well as not having any bowel or bladder issues. So as long as that is...
Because then it could be infection-based or something, right?
Infection, you could
have the cat cause it? Could the cat cause it?
Yeah, well, the cat's a good tester. You can check that everything's still working, but can I feel the scratching?
Well, there is a disease called cat scratch disease.
Is there really?
Wait a second. Tell me about that, because I have a massive scratch. Tell me about that.
It might involve a prostate exam. And
it's flirtatious.
Yeah. No, it's.
Wait a second. So, are you being serious?
Yeah.
Can you do that now?
Disease.
So, Hey, wait, James. Where am I home?
Yeah, there's a camera on the head there that can be used.
Now I'm nervous, actually.
No. Don't worry about that.
Okay.
It has nothing to do with your back pain.
Okay.
You would have more infectious symptoms. You'd be a lot more systemically unwell.
Okay, yeah, no, I feel pretty good, and mentally I feel pretty good too. You know, the pain sucks, but it helps to know that there's sort of an end game here without getting on these crazy drugs that so many other doctors, I'm sure, you're probably in the lower 5 percentile that would just go and prescribe and get you out of their office and stuff. And it's really, to me, honestly, and I say this very wholeheartedly. A lot of things I say aren't genuine, but this one really is. To know that this world and this country specifically is kind of getting behind such a great movement and helping people much more naturally. I think we're going to be, and this is just from everything I've read, and it's really not a biased opinion because, Tweed Main Streets has sort of just been so good to me, but it's about, just taking care of human beings naturally the right way, and it seems something still holistically, and it's so nice to know that this is the direction we're headed in. And thank you to you, honestly, Dr. Schecter, for helping, like as James said, pioneer this.
Oh, my pleasure. And it's just seeing people like you being able to get up, do their daily activities, and interact with the world without being completely put out on the couch with their pain or their anxiety makes me so happy.
Good to know. And I guess I sort of wrapped it up there nicely, but I have one more question. You mentioned the 101-year-olds now. So first off, I don't know, James. I'm not going to make it to 101. You?
No, definitely not. I'm lucky to be here, to be honest.
But and when you prescribe it to a much older person, say, is there at first a bit of a stigma for them? Are they unsure? Do they think they're going to get all messed up? And how do those conversations go?
Usually those patients just want something that's going to work. And it's funny, some of these people actually remember when cannabis was available.
Wow, before Reefer Madness.
Before Reefer Madness.
That's unbelievable.
Cannabis.
Can you imagine going? Yeah, like you're there. It's normal. It's helping you, and then suddenly 70 years of it's dangerous, and then suddenly it's back again.
It's crazy. Self-driving cars, and they didn't even have a car, but yet I'm being serious. Like, it's wild.
Cannabis was made illegal in the United States in 1937. And at that point, the American Medical Association knew the medical benefits of cannabis and was completely against the government making it illegal.
Interesting.
Which blows my mind.
Well, and I've read the past Reefer Madness stories where a lot of it was sort of racially motivated and stuff, and
socially, economically, politically,
to bring back a form of slavery, essentially, right? That's why they. Yeah.
Well, yeah, I mean they were. I mean they were. It's terrible, and saying how. Anyway, I won't get in, but there were some of the stuff I read anyway was very racially motivated. That they would give it that African Americans would give it to white women was what they deemed
the Mexicans,
or the Mexicans.
That's where
there's that documentary
comes from.
The house I live in. There's a documentary film about this that sums up everything we're talking. Yeah.
Okay, I gotta check that out, and not the house you live in because it's full of cat piss. Right?
Well,
exactly. Not that one. Well, Dr. Schecter, thank you so much, and I think Shega's here. Shega, did you bring me a present because I'm in pain? Is that what you did, Shega? Yeah.
Brought you a little present from Tweed. It's a humidor, so it's going to keep your cannabis nice and fresh and store it in a really pretty box that you can keep.
I got a pretty Tweed. Oh, this is so nice. I think we'll open it. We'll make sure we get pictures of it, throw it up on Twitter. Oh, look at that. That is a beautiful box, actually. Cannabis, and I'll put a few dollar bills that I have in there. Pretend it's myself. Oh, that is actually super gorgeous.
Oh, my goodness.
Is there stuff? Is there? Oh, wow. Oh, that's so great. There's like, anyway, I'll describe this. It's
like an audio unboxing.
I'm doing an audio unboxing. Yeah, it's not as effective, but I'll make sure to take a picture of that. Is brilliant. Do you sell these?
We do. Yeah.
You do? You sell them?
Yep. We sell them at tweedmainstreet.com. Visit our merchandise page.
Okay, Tweed Main, and this is something I think everyone wants. Dr. Schecter, thank you so much for your time, my friend.
My pleasure.
Cheers.
The Todd Shapiro Show. Canada Laughs. SiriusXM 168.